If you're an older man who masturbates, you might have wondered whether it's truly healthy past age 50 or 60, or if it could be causing unseen harm. You're not alone in these thoughts. Today, we'll dive into an honest, evidence-based discussion. I'm going to walk you through 5 powerful science-backed benefits of masturbation for older adults, and then, crucially, 5 potential risks you need to be aware of to ensure your practice is a healthy one. Let's start with the good news first. Ever wonder why some seniors stay spry? A stronger heart. First up, your heart. Orgasms increase blood flow and act like a mini cardio workout. In fact, studies show older men who enjoy regularly are less likely to develop high blood pressure. That means a healthier heart without ever leaving the bedroom. Hormonal balance and stress reduction. When you experience pleasure, whether alone or with a partner, your body releases a powerful cocktail of beneficial chemicals. We're talking about dopamine, the feel-good neurotransmitter that elevates your mood, and oxytocin, often called the love hormone, which promotes relaxation and reduces stress. Chronic stress is linked to everything from heart disease to cognitive decline. Pleasure is one of your body's most effective natural stress busters. One study during the COVID-19 pandemic found that people who maintained regular activity had lower rates of depression and anxiety. When the world was falling apart, those who prioritized their wellness had better mental health outcomes. Sleep quality improvement. This one might be the most immediately noticeable benefit. A 2025 study, yes, brand new research, found that engaging in adult activity before bed led to measurably improved sleep quality. People fell asleep faster, stayed asleep longer, and had higher sleep efficiency compared to nights without adult activity. The reason? That cocktail of hormones released during climax includes prolactin, which promotes deep relaxation and drowsiness. It's like nature's own sleep aid, with no side effects or morning grogginess. Natural pain relief. The endorphins released during climax act as natural painkillers. Many older adults with chronic pain, arthritis, or other discomforts report temporary relief after adult activity. These endorphins can be more effective than over-the-counter pain medications, and they come with the bonus of improved mood rather than potential side effects. Cognitive benefits. Here's something that might blow your mind. A study of adults aged 50 to 89 found that women who engaged in more frequent adult activity performed better on memory tests. The difference was statistically significant, meaning it wasn't just chance. Stimulation appears to have genuine brain-boosting effects, possibly through improved blood flow and hormone production. Gender-specific benefits. For men, regular ejaculation, whether through partnered or self-pleasure, has been linked to reduced prostate cancer risk. A large analysis found that men who ejaculated 2 to 4 times per week had significantly lower cancer rates. The proposed mechanism is that regular ejaculation helps flush out the prostate, preventing buildup of potentially harmful substances. For women, activity helps maintain vaginal health after menopause. It increases blood flow to the area, stimulates natural lubrication, and keeps tissues more elastic and healthy. Women who remain active often have less discomfort and better genital health as they age. Immune system support. Activity has been associated with modest improvements in immune function. The stress reduction, improved sleep, and hormonal benefits all contribute to a stronger immune system. Some research even suggests that the endorphins released during climax may contribute to cancer cell suppression in the body. The cost of inaction. What happens when you give up. 1. Physical health. Men. Higher risk of prostate problems. There are studies that infrequent ejaculation is associated with an increased risk of prostate cancer. The chance of erectile dysfunction also increases, as tissues without a regular blood supply gradually lose elasticity. In women, increased vaginal dryness and atrophy, weakness of the pelvic floor muscles, which increases the risk of urinary incontinence. General. Worse sleep, less natural pain relief in the body, higher levels of cortisol, stress hormone. 2. Psyche and mood. The lack of release when you want it can increase stress, anxiety, and lower your mood. Self-confidence and life satisfaction often decrease. In studies, older people who have maintained activity, including through masturbation, more often report higher levels of happiness and self-esteem. 3. Cognitive effects. There is evidence that men 50+ who masturbate regularly show better results in memory tests. With complete abstinence from activity, this stimulating effect on the brain disappears. 4. Health risks of prolonged abstinence. Studies on thousands of elderly people show that men and women who completely lose adult activity have, on average, a higher risk of serious illnesses. In men, the risk increases to 65%. That is, masturbation is a marker and factor of health. If you stop completely, other problems often catch up. What happens in the body during the first week, month, and 3 months of abstinence? First week of abstinence. Physiology, no significant changes yet. Blood flow and tissue tone of the genitals are maintained, especially if the person is physically active. Hormones dopamine and oxytocin levels are lower than with regular adult activity. This can lead to mild irritability or difficulty falling asleep. Psyche. Some people experience more stress or anxiety, especially if abstinence is forced. 1 month. Men. The frequency of spontaneous erections at night decreases. This is the first marker that the blood flow in the cavernous bodies is weakening. Women. Slight vaginal dryness begins to appear if there are no other stimuli for blood flow. General. Decreased sleep quality and slightly higher levels of cortisol, stress hormone. Psyche. People who value adult activity may experience a feeling of dissatisfaction and decreased motivation. 3 months. Men. The risk of early manifestations of erectile dysfunction increases. Research shows that in men over 55, the lack of regular adult activity is associated with a doubling of the likelihood of erectile problems. Women. Dryness and atrophic changes become more noticeable. Tissues lose elasticity. Hormones. Some people have reduced resistance to stress. Pressure surges are possible due to higher baseline cortisol. Psyche. Irritability and vulnerability to anxiety are more common. 6 months. Cardiovascular system. Studies show that hypertension and cardiovascular diseases are more common in elderly people who have completely lost adult activity. Men. Congestion begins to accumulate in the prostate. This increases the likelihood of inflammation and, in the long term, the risk of tumor changes. Women. Blood flow in the pelvic area is significantly reduced, which accelerates the development of urinary incontinence and pain when attempting adult intercourse. Cognitive functions. There is no stimulation, which in studies correlates with better memory. In women over 60 without adult activity, verbal memory indicators decline faster. Psyche. Lonely people often experience a feeling of isolation and subjective satisfaction with life decreases. Reclaiming your right to complete wellness. Adult health isn't a luxury or an indulgence. It's a legitimate component of healthy aging, recognized by the world's leading health authorities. The research is clear. Maintaining adult wellness throughout your life can protect your heart, boost your mood, improve your sleep, sharpen your mind, and add years to your life. You have the right to complete wellness at any age. That includes the right to intimacy, pleasure, and adult expression in whatever form feels right for you. Don't let society's discomfort with aging adult rob you of these proven health benefits. Don't let myths and misconceptions keep you from living your fullest, healthiest life. Your attractiveness and desire didn't expire on your 60th birthday. Neither did your right to pursue every avenue of health and happiness available to you. If this information resonates with you, I encourage you to have an honest conversation with your healthcare provider about adult wellness as part of your overall health plan. Share this information with friends who might benefit from it. And most importantly, give yourself permission to prioritize this aspect of your health without shame or embarrassment. Because when it comes to healthy aging, adult wellness isn't just an option. According to the medical evidence, it's an essential part of living your best life after 60.